Hello folks, Joe Ahmad again, and let's today talk about the anatomy of the nose and the nasal cavity. First of all, nose. So we have divided the nose into an external nose and nasal cavity. So the external nose is this protuberance that you can see in between your eyes. So this external nose is then again divided into its osteocartilaginous framework. We will study that, then we will study a musculature, and then the skin above it. So the external nose is basically a skin, then the musculature beneath it, and finally the osteocartilaginous framework, that is the framework that is made of cartilage as well as the bone. Then moving on to the nasal cavity, then we will in the nasal cavity we will see that there is a vestibule, which is just the opening where it is lined by the skin, and then we have the nasal cavity proper. The nasal cavity proper include the whole nasal cavity, which is lined by the basically by the mucous membrane. So vestibule is lined by the skin, whereas the nasal cavity proper is lined by the mucous membrane. Now the nasal cavity consists of a medial wall. You can see it's a pyramidal cavity, just like a pyramid if you look at it, the whole cavity, and it is divided by septum into two cavities, and these cavities are somehow also pyramidal. Now you see that there is a medial wall, or here is a medial wall, then there is a roof, then there is a lateral wall, and then there is a floor. So this is the cavity that we are talking about, and we will cover each of these structures. But first of all, we will cover the external nose. So the external nose is actually a prominent structure that lies in between your eyes, and it is an entrance to the respiratory tract. Moreover, it is also the organ of the olfaction. So that's all about the external nose. Now if you look at the anatomical structures and the various landmarks that you have to understand the surface anatomy. So first of all, here is your tear trough, this present around the nose. Then you can see there is the dorsum of the nose, or the nasal bridge, which is also called as the nasal bridge. Then you have a supraellar crease. This crease that you see, that is above the ala, this is ala, so that is called as supraellar crease. These are your ala or domes. Then you have two openings which are called as nostrils. The central region is called as columella. This region is called as columella. And then you have got the lips below, and here you see a depression. So this depression is called as philtrum. So these are the landmarks you need to know. Tear trough, then you have supraellar crease, you have ala or domes, then you have a tip, then you have nostrils, you have columella, you have philtrum. Moreover, here is shown the glabella, which is actually the area of the skin in between your eyebrows. So the glabella is over here. Then the nasion is actually this is the region where the frontal bone as well as the two nasal bones, so they meet one another. So here is the center of the joint that is formed over here. The sutures, they meet one another, the two nasal bones as well as the frontal bone, so they meet one another at the nasion. Here is your nasal bridge, supratip break. So this is again a feature that you will want to know. The supratip break, then there is an infratip break, and there is your tip. Moreover, this angle in between the lip as well as the nose is called as nasolabial angle. So these are the points of the surface anatomy that you may need to know. Now we will go deeper, and if you look at the nose, so basically it is a skin, then there will be some muscles beneath it, because you can move your skin, so move your nose, so that is basically the work of the muscles. And then there are some beneath that will be bone and cartilage, so that forms the framework of the nose. So let's cover them one by one. First of all, the osteocartilaginous framework. The osteocartilaginous framework means that the framework of the external nose is made up of the bone as well as the cartilage. Now the upper 1/3 of the nose, or here this upper 1/3 of the external nose, this is made up of the bone, whereas the lower 2/3 of the external nose is made up of the cartilage. Now here, do remember that I am talking about the external nose, that is upper 1/3, that the upper 1/3 is made up of the bone. However, the nasal cavity or the internal nose, that goes as deep as the pharynx, so that involves a lot of bony structure that you will see, the ethmoid and all that stuff. So basically the external nose, that is composed of the upper 1/3 of the external nose is composed of the bone. Now here we have a nasal bone, this one, the nasal bone, two nasal bone basically, one on each side, and they meet each other over here with the frontal bone, and they form the nasion that I was talking about in the previous slide. So this is the region of the nasion where the two nasal bones and the frontal bone, the sutures of these meet one another. Here is your maxilla, so maxilla and nasal bone, so these form your bony part. Moreover, if you look at the cartilaginous part, now the cartilaginous part is a bit more complex. You can see that this cartilage is called as the lateral cartilage. This is your lateral cartilage. Now the lateral cartilage extends from the undersurface of the nasal bones. You can see here from the undersurface of the nasal bone, and it goes up to the alar, the lower alar, major alar cartilage. This one is your major alar cartilage. So it goes from the nasal bone and from the maxilla and extends up to here. And at the lower margin, this here is not fused with this alar cartilage, but it is somehow free on the inside, and it will form the nasal wall, as you will see shortly when we discuss the nasal cavity. So this take parts in the formation of the nasal wall, which is basically from this, if you look at this edge, here will come the inferior turbinate on the inside, and then there will be nasal septum and the floor. So this surrounds structure will be called as the nasal wall. It will be explained shortly. For just know that you have the lateral cartilage. The lateral cartilage extends from the nasal bones up to the alar cartilage, and its lower border takes part in the formation of the nasal wall. Let's talk about the other cartilage that is below it. That is called as the major lateral cartilage. So major alar cartilage, sorry, this is the lateral cartilage, this is the major alar cartilage. Now the major alar cartilage is U-shaped, as you can see, and this U-shape, and it has a medial as well as this is the medial crust, whereas this is the lateral crust. So the lateral crust form the L of the nose, or you can say the dome, the dome shape. So this is your lateral crust of the alar cartilage. Moreover, this here it forms the columella, and it joins the medial crust joins the columella. So the lateral crust overlaps the lower edge of the lower lateral cartilage on each side. So it overlaps it. So I have told you that this lower end of this lower lateral cartilage, it just goes underneath it, and it take part in the formation of the nasal wall. So this just overlaps the lower edge of the lateral cartilage. Just to remember it, it is a U-shaped cartilage forming lateral and medial crust, lateral crust forming the ala, medial crust forming the columella. Now let's talk about the minor alar cartilage, which are two in number. As you can see here, these are basically submerged into the fibrofatty tissue, and over here you can see this is the fibrofatty tissue, which mainly form the lower free margins of the nostrils. So this is fibrofatty tissue, and it mainly forms the lower end of the nostrils, free end of the nostrils. That is it. Now the next thing is the septal cartilage that we have missed. So this septal cartilage, as you can see here, so as the name indicates, so it forms the septum. The most of this cartilage you will see when we study the nasal cavity. So this in the nasal cavity, this medial whole wall will be formed by this septal cartilage mainly. In front, behind, it will be formed by bones, but this septal cartilage forms the medial wall. So mainly you will see it in the nasal cavity, but a small portion is shown here. So that will form the septal cartilage, and it mainly is somehow attached to this lateral cartilage, so that if any dislocation of this septal cartilage occurs, it will also causes some deformities into the lateral cartilage as well, and that are clinically important. For just now, remember that the osteocartilaginous framework consists of two nasal bones and a maxilla, the frontal process of the maxilla. So here is your nasion, here are your two bones, then you have lateral cartilage, and then you have alar cartilage, major alar cartilage, which is U-shaped, forming the ala as well as the columella. Then you have the minor alar cartilages, and then you have fibrofatty tissue. So that's all about the osteocartilaginous framework. Now let's move ahead. Now we will talk about the nasal musculature. So we have studied that the external nose is made up of skin, then there is musculature, and then there is osteocartilaginous framework. So we have just done the framework. Now let's talk about the musculature. So the musculature is concerned, it is not high yield, and it won't help you a lot, but just remember it. There are some elevators of the nose, such as the procerus muscle over here that you can see. This is your procerus muscle, and there is levator labii superioris nasi eliki muscle. So eliki nasi. So this one you can see. So these two are the elevators of the nose. Then there are some depressors. That is the Eller part of the nasalis. So here is your nasalis muscle. This is its transverse part. Its nasalis part is lying here. So that is a depressor, and there is a depressor nasi. So these two muscles, the depressor nasi as well as the Eller part of the nasalis, that will cause the depression of the nose. Then there are some compressor muscle which compresses the nose. So the transverse part of the nasalis muscle, this nasalis transverse part, so this will cause the compression of the nose. Moreover, the compressor narium minor, that's quite a difficult name, compressor narium minor. So that is not shown, I guess, here, not shown here. Then there are dilators. So dilator naris muscle, the anterior as well as posterior muscle, so they dilate when they contract, so as a result they dilate the nose. So this is the nasal musculature: elevators, depressors, compressors, and dilators. This is the movement that take place in the external nose. Now I hope you have understood it. We have done the osteocartilaginous framework, the nasal musculature, and I hope you remember the skin that is just overlying it, and we have studied the surface anatomy already. So that's only with the external nose. Now let's move ahead to the nasal cavity. If you look at the nasal cavity, as you can see here, this inside, so this is your nasal cavity or the internal nose. So it is a pyramidal cavity, a pyramid shaped, and it is divided by the nasal septum into two cavities. Now we have a vestibule, which is the initial portion of this nasal cavity, and it is mainly the difference between the nasal cavity proper and the vestibule is that the vestibule, on the inside, it will be lined by the skin. That's why you see the hairs in your nose. So this is the portion which is lined by the skin, where your nasal hairs are present. And then we will come to the nasal cavity proper, which will be lined with the mucous membrane. Now the whole nasal cavity will have a medial wall, a lateral wall, a roof, and a floor. So that's all that it will have. Now let's talk about it one by one. Now just to remind you that in this video we'll be covering the vestibule, the medial wall, the roof, and the floor, whereas the lateral wall, which is a very bulk of a topic itself, so we have made another video, a separate video of that. So just stay with us. First of all, the medial wall. Okay, first of all, the vestibule. So vestibule, I have just told you that it is the skin lined portion of the nasal cavity. This is the nasal cavity. So the initial part, where the very initial part of the nostrils, near the nostrils, so this portion is your vestibule. Now the vestibule contain hairs, and these hairs, what is the function of these hairs? That they prevent the entry of the large objects such as the insects. So they don't allow the insects and the large objects to enter into the nose. Moreover, the here is the formation of the nasal wall that I have talked about previously, and this is important. Now here you can see, if you take a section at the lower end of the lower lateral cartilage, if you take a section, and here you can see that section, so this is the lower end of the lower lateral cartilage, overlying skin. Then this blue area that you can see, so this is your lower lateral cartilage. Of course, this is the mucous membrane that on the inside, the pink, and here is again your nasal septum shown, and then the mucous membrane overlying it. And these are shown over here is actually the anterior portion of the inferior turbinate. So these are the anterior portions of the turbinates, the inferior turbinates. Now if you can see here, now this area is called as the nasal wall. These form the nasal wall. How is it formed, and why it is called as nasal wall? It is actually called as a nasal wall because this area, it is the smallest in cross section to the airflow. So this area is the least cross-sectional area of the nose that regulate the air inflow and resistance on inspiration. So this area is very important because if this angle just gets narrow, and this whole area controls the inspiration, so as a result the inflow of the air will be low throughout the respiratory tract. So this is area of prime importance. And normally this angle between the lateral cartilage and the nasal septum is 30 degrees, and sometimes the collapse of the nasal wall, so they are treated surgically by just widening this angle. So that's the importance of the nasal wall. So important thing to remember is that the nasal wall is from over here, the lower part are of the lateral cartilage, then the anterior portion of the inferior turbinate laterally, so they form laterally. Then on the medial side you will see the medial septum, and of course below you will see the floor of the nasal cavity. So that hole form the vestibule, or that hole form the nasal wall. So that's how you have to remember. Now let's talk about the medial wall of the nasal cavity. Now the medial wall of the nasal cavity, as you can see here, it is composed above the nasal septum. So the nasal septum is quite a term in itself. Now the nasal septum is divided into the columellar septum, which is actually the septum that is formed by the columella, and it is of course this is the area of the vestibule, so this will be lined by the skin. Then you have the membranous septum, this lying in between the columellar portion and the septal cartilage, or the septum proper septum. So this small area, this is called as your membranous septum, and it is lined by the skin as well. Now this you can see that if you just hold your nose in between your index finger and the thumb, the columella, hold the columella in between your index finger and thumb and just pinch it outwards, and then you will see a small area of the skin where there is nothing in between, just the skin. So this area where there is no cartilage, no bone, just the skin meeting opposing one another, so this area is your membranous septum. Then after that you have the septal cartilage, or the proper septum. So that proper septum or septum proper, that includes the bony as well as the cartilaginous part. Now the first of all, it is from if you look at the bony part, so of course you have the perpendicular plate of the ethmoid, then you have the vomer bone, and then you have in the front you have the septal cartilage. And moreover, there is also minor contribution from the other bones. Say for example, there is a crest of the frontal bone, then there is of course there is small crest from the sphenoid, there is a small crest from the sphenoid bone as well, that is called as the rostrum of the sphenoid bone. And then you have small nasal crest that is formed from the maxilla as well as the vomer bone, as well as the palate. This is called as palatine bone. So the palatine bone gives a small crest, as well as the maxillary bone gives a small crest. And then we have the so these are the small minor contribution. If you start from the top, from the frontal bone goes, there is the rostrum of the sphenoid bone, there is the vomer bone and the maxillary bone, so they all give a small contribution to it. Moreover, the maxilla also form a small this process which is called as, what is it called, I just have lost its name. So this is called as spine, a spine of the maxilla, anterior nasal spine of the maxilla. So this is also given by the maxilla. Now this septal cartilage, it is held in position by the groove that is present on the anterior surface of the this vomer bone. So it form a groove over here. Moreover, there is the anterior nasal spine of the maxilla, so it holds the septal cartilage in its place. So this septal cartilage, if there is any injury to it or any abscess or anything to it, so if it is damaged, then supradepression occurs. Why that occurs? Because it is actually holding the dorsum of the nose, so it is providing support to it. So anything that damages it will cause the supratip depression. Moreover, we have also said that this septal cartilage, it is lying on the tip or the dorsum of the nose as well, and it is attached to the lateral cartilage as well. We have shown it here in this first slide, that this is your septal cartilage and this is your lateral cartilage, so they are joined with one another as well. So if there is any deformity of the septal cartilage, if there is a dislocation of it, such as occurring in the trauma or anything, so what happens that there is the dislocation of this cartilage as well, so you face a deformity. So that was all about the medial wall of the nasal cavity. We have talked about the supratip depression as well, and the supratip cartilage attachments and its dislocation as well. Now let's move ahead and let's talk about the arteries of the medial wall. So the arteries of the medial wall are 5 in numbers. You can see there is anterior ethmoidal artery, posterior ethmoidal artery that are coming from top. Then you can see from the back there is a sphenopalatine artery. Then you have greater palatine artery and superior labial artery. So these all arteries form anastomosis in this area, in this anterior-inferior area of the nose or the nasal cavity on the medial side. So this area is called as the Kessel plexus. And this is very important area because this is the commonest site of the epistaxis, which is actually the nosebleed. So due to any trauma or anything, so this region usually bleeds and it is high yield to remember. So remember the arteries: anterior and posterior ethmoidal, sphenopalatine artery, greater and labial artery, greater palatine and labial artery. So that was all about the medial wall. Now let's talk about the roof and the floor of the nasal cavity, which are pretty easy. First of all, the roof, if you can see that the roof of the nasal cavity, first of all, here it is this sloping area is formed by the nasal bones, as we have studied in the start. So the two nasal bones form this sloping area in front. Moreover, this sloping area behind the roof, the sloping roof in front is formed by the which bones? Okay, you got it, by the two nasal bones, whereas on the posterior side it is formed by the sphenoid bone. And in the center you can see this whole area, this whole roof is formed by the horizontal roof is formed by the ethmoid bone. So this ethmoid bone contains small grooves through which the ethmoid nerves passes. So this is called as the cribriform plate. So that's all about the roof. Let's talk about the floor. Now floor is pretty easy. You can see up front there is the 4 by 5 area is mainly formed by the maxilla, and there is 1/5 of the area is mainly formed by the horizontal plates of the palatine bone. So that's all about the roof and the floor of it. Okay, that would be all for now. If you have found this video beneficial, hit the like button and subscribe to our channel for other lectures and other medical stuff. And let me know about any shortcomings in the comment section below. Thank you very much.